and thanks for joining us on Chicago Tonight. I'm Brandis Friedman. Here's what we're looking at.
I'm bracing for what could be mid-year layoffs.
Are city workers going to be facing layoffs this year? As federal health officials scale back on vaccine recommendations for American children, measles cases are on the rise. And what new cuts in grant funding mean for after-school programs and other support services at some schools in Illinois. First off tonight, as major cities across the country continue to see ramped up immigration enforcement, a surge of 2,000 federal agents to the city of Minneapolis has turned deadly. A 37-year-old woman, Renee Nicole Good, was shot while driving an SUV in a residential neighborhood south of downtown Minneapolis. A crowd of protesters gathered in the area where the shooting happened. Department of Homeland Security Secretary Kristi Noem says the officers were acting in self-defense, alleging the SUV was speeding toward them. Witnesses on the scene also described what they saw.
A third person in also camouflage fatigues came and started pulling on the driver's side door handle, at which point the vehicle backed up a few feet and started driving forward. The agent who was on the driver's side originally, who was not pulling on the handle but had been there prior to that, shot 2 or 3 times through the driver's side window.
It was an act of domestic terrorism. What happened, it was our ICE officers were out in an enforcement action. They got stuck in the snow because of the adverse weather that is in Minneapolis. They were attempting to push out their vehicle, and a woman attacked them and those surrounding them and attempted to run them over and ram them with her vehicle.
Meanwhile, the Minneapolis police chief says the driver was not attempting to harm the agents. Minnesota officials say state authorities will also investigate the shooting along with federal authorities. Mayor Brandon Johnson is warning there could be layoffs if revenue baked into the city's budget fails to materialize. Johnson has repeatedly called the spending plan that went into effect this month when he chose not to veto it unbalanced and says it leaves the city facing a $163 million deficit.
There were alders who chose to create projections that, quite frankly, just were not tethered to reality, quite frankly. We're going to monitor it closely, and in the event that shortfall does exist, then we're going to have to go before City Council again and have another conversation about ways in which we can either mitigate the harm or have to deal with the harsh reality where people will be laid off.
The largest chunk of that potential deficit is $89 million in debt the city plans to collect from Chicagoans who are overdue on utility bills and red light cameras by selling the debt to a private company. Johnson says that move is unlikely to generate significant revenue. The city may be on its way to giving the Chicago Police Department authority to implement a curfew with at least 12 hours notice in an effort to curb large gatherings of teens. City Council's Public Safety Committee voted today to allow the police superintendent to declare a preemptive curfew before a planned mass gathering. Mayor Brandon Johnson says he's not decided whether he'll veto it. What the committee did not decide on is another ordinance that would require social media platforms to take down posts designed to advertise, quote, unlawful teen gatherings within 6 hours of being notified by city officials that the posts violate local laws. The curfew ordinance could get a vote from the City Council on January 21st. A Cook County father is suing the popular online gaming platform Roblox, claiming the company uses reckless and deceptive business tactics that led to the sexual exploitation of his 9-year-old son. The federal lawsuit was filed in Northern California, where the company is based. The 82-page complaint says the child was targeted by an adult predator who gained his trust through the app's chat function, eventually leading to the exchange of sexually explicit images. Attorneys say the company has never provided sufficient safety measures to protect children and accuses it of deliberately concealing information about alleged pervasive predatory conduct that the app, quote, enables and facilitates. In a statement, Roblox says its policies are actually stricter than those found on many other platforms. Up next, the danger of falling vaccination rates and a rise in measles cases. That's right after this.
Chicago Tonight is made possible in part by the Alexandra and John Nichols family, the Polk Brothers Foundation, and the support of these donors.
In perhaps its most dramatic and consequential move yet, the Centers for Disease Control and Prevention has cut the number of vaccines recommended to American children. Meanwhile, the number of measles cases in the country has reached its highest level in more than 30 years. At more than 2,000 confirmed cases in the U.S. last year, 14 of which were in Illinois, the country is in danger of losing its so-called elimination status. Joining us are Chicago Department of Public Health Medical Director Dr. Brian Bora, Dr. Allison Bartlett, Professor and Pediatric Infectious Disease Specialist at University of Chicago Medicine. And on Zoom, we have Dr. Samir Vora, Director of the Illinois Department of Public Health. Welcome back. Thanks to all of you for joining us. Okay, so starting with this news about the immunization schedule, here are some of the major changes. The HPV recommendation shifts from 2 doses to 1, stating that 1 dose of the HPV vaccine is as effective as 2 doses. This is, of course, according to the federal government now. Only children who are considered, quote, high risk are recommended to receive the RSV, hepatitis A, Hep B, dengue, meningococcal, ACWY, and meningococcal B. You guys don't know what that means either, do you? I'm kidding. And immunizations based on, quote, shared clinical decision-making are for rotavirus, COVID-19, influenza, several others, meaning that those vaccines can only be administered after consulting with a healthcare provider. I want to get your reaction to these changes, and I want to go around the table. Dr. Brian Bora, I'll start with you.
Yeah, thanks. I mean, this decision was based entirely on ideology and was not based on any new scientific evidence or any new data. You know, this was sort of a predetermined outcome by a group of people leading HHS. You know, here in Chicago, we still endorse the old set of vaccine recommendations. Unfortunately, we have our own processes in place here in the state to continue in a transparent process, a transparent way, using scientific evidence to make recommendations for the people of Illinois.
Dr. Bartlett?
I echo the fact that I'm grateful to be in Illinois, where we are, again, relying on the sort of historic recent recommendations that are science-based, but it really poses some confusion for parents and families, and I think also gives the impression that the recommendation to use sort of discussions with family about decisions for their children that's something that we do all the time, and we provide medical care. Everything is done in great consultation with patients and families.
Dr. Samir Vora, your reaction?
Yeah, I would say I agree with both Dr. Bora and Dr. Bartlett. The challenge here is that we're in a place where decisions are being made by the federal government that are not based on up-to-date scientific information. And we're fortunate here in Illinois, with the governor's leadership, the recently passed House Bill 767, that the Illinois Department of Public Health, in consultation with our Immunization Advisory Committee, Dr. Bartlett is a member, Dr. Bora has given presentations that really allow us to maintain those scientific processes. Ultimately here in Illinois, the changes by the federal government have no bearing on Illinois' recommendations. We provided a notice to providers on that today. We're ensuring that we have good, clear messaging so that our providers know what recommendations to follow to ensure the health of their patients.
HHS Secretary Robert F. Kennedy Jr. says that the changes to the immunization schedule align with the schedules of other developed nations, Denmark, Germany, Japan. Dr. Bora, was America's longstanding guidance, was it really that different from our peers?
It really wasn't. And the truth of the matter is every country has a vaccine schedule that's designed for that country specifically. Historically, you know, for decades, we've had an established process by which vaccines were reviewed, recommended, you know, scientific evidence looking at their effectiveness and their safety were carefully scrutinized for every single individual vaccine. And so this vaccine schedule that was developed for the United States is based on decades and decades of scientific evidence.
Dr. Bartlett, what are your concerns with comparing the U.S. vaccine schedule to that of other nations?
So I think there's a couple concerns. One is, as you know, based on the epidemiology, the frequency of diseases in each country can vary, so recommendations can vary. I think vaccines are a really powerful preventative health tool. We don't have access to the kinds of preventative health care, government provided, right, insurance and other access that other countries have. And so we rely more on some of the vaccines compared with other nations who have different healthcare systems.
And also, I mean, a nation like Denmark is the size of, it's been compared to like the size of the state of Wisconsin, for example, right? A much bigger nation U.S. is, and going to have different issues. Exactly. In a statement, Dr. Mehmet Oz, administrator for the Centers for Medicare and Medicaid Services, said, quote, all vaccines currently recommended by CDC will remain covered by insurance without cost sharing. Dr. Vora, does this mean that, vaccines that are not offered will no longer be covered? And how is Illinois responding to that?
Well, I think there was some reassurance in the statements by Dr. Oz and Secretary Kennedy to ensure that access will remain on all of the immunizations that were recommended, whether in shared clinical decision making or routinely recommended, and that they'll be covered by government-based insurance programs. Private insurances have said that they will continue to cover vaccinations with the schedules before these changes are being made. I think through our efforts, we are working to ensure that that is the case, but we want to be prepared here. It's good that those things have been declared, but we're seeing a number of changes. As Dr. Bartlett previously mentioned, it causes uncertainty to our providers. We're working across state agencies with the statewide vaccine initiative to ensure clarity and to provide as many tools to ensure that access is there for all Illinois-based recommendations that meet scientific standards.
And then there's the measles, the largest measles outbreak in the country, currently in South Carolina with 214 confirmed cases, followed by Arizona with 205 cases and 176 in Utah. Dr. Bora, what would you say is driving these outbreaks and, the lower vaccination rates as well?
They're one and the same. So when you have pockets of people that are unvaccinated in close, that are in close-knit community, that's a recipe for a measles outbreak. So I think, over the past couple of years, we've seen declining vaccine coverage across the nation, really. And unfortunately, I think we're seeing some of the consequences here in the form of this outbreak. And we're not the only nation seeing this. Our neighboring nations in Mexico and Canada have seen a lot of measles as well. So we have a lot of work to do.
As mentioned, federal health officials, they still recommend that all children vaccinate against measles, but the CDC is investigating whether or not to break up the MMR vaccine for measles, mumps, rubella, essentially saying that it should be separated, separate vaccines rather than one combined shot. Dr. Bartlett, what would be the impact of separating them?
So the impact of separating them would be, I think, that fewer individuals be vaccinated for each of those components. Right? We just mentioned our healthcare delivery issues in the United States, and giving more vaccines at more visits where there's already limited access is a challenge. Families, have challenges traveling to their appointments, getting in to see their doctor. So being able to do 3 or 4 or more vaccines at the same time is a much more efficient way to deliver care.
What are some of the long-term effects of contracting measles?
So that's a great question. So many kids who get measles have a pretty significant febrile illness with a rash. But about
febrile meaning feverish.
High fevers, thank you so much, and a big, impressive rash and a stuffy nose. But about 10% of kids end up being hospitalized with measles. I speak more about children because many adults are more likely to be immune, and all infants under age 12 months are vulnerable because they haven't been vaccinated. And then there are much more serious, severe consequences like swelling and inflammation of the brain, and 1 to 3 out of every 1,000 kids will die.
Dr. Vora, before we run out of time, what are the sort of the societal repercussions to having a measles outbreak?
Well, I think as both Dr. Bora and Dr. Bartlett said, this is part of the challenge around vaccine hesitancy. But I think there are also sort of ways in which we here in Illinois, through partnership in Chicago and other states, that we saw still 14 cases, but only 14 cases when we've seen kind of 2,000 across the country. And part of this has been great partnership, local health departments, providers, putting out opportunities for mobile clinics, getting education out there, and really trying to move these efforts on grassroots levels to really ensure that people stay healthy. And that's the core message here, that despite the hesitancy and reluctance, putting out the best science, answering people's questions so that we can minimize these kinds of outbreaks, and when they happen, respond to them very quickly.
Thankfully, it's just 14, not more than that. Thanks to the doctors, plural, for the work that you all do and spending time with us. Dr. Samir Vora, Brian Bora, and Allison Bartlett. Thanks, everyone.
Thank you.
Thank you.
Up next, more federal funding cuts, this time for community schools. The U.S. Department of Education is terminating $168 million in grants for full-service community schools across 11 states. Those are schools that partner with community groups to provide a range of services for students and their families. About $18 million of that funding goes to Illinois schools, where it supports a variety of programs in underserved communities. A department spokesperson says the decision aligns with the Trump administration's, quote, rejection of diversity, equity, and inclusion initiatives. Joining us to talk about how the loss of funding is impacting Illinois schools are Susan Stanton, Executive Director of Act Now Illinois, an organization providing after-school programs to schools across the state, and via Zoom, Patrick Brosnan, Executive Director of the Brighton Park Neighborhood Council, a community organization serving Chicago's Southwest Side. Thanks to you both for joining us. So, Susan, Act Now, you all are the Illinois organization that applies for this grant and then disperses it to organizations like Patrick's and others. Tell us about the full-service community school model and what that grant money gets used for.
Yeah, the full-service community school model is a reimagining of how we do education. It understands that when students walk into a school building, they face many obstacles that prevent school day learning. If you're going into school and you're hungry, or your parents aren't employed, or you don't have clean clothes or access to hygiene products, it's going to be really hard to focus in math class. What community schools do is they look at the local problems and what individual students and families need, and they bring in partnerships to try to mitigate those issues so that way students are set up for success in their education and hopefully long-term in life. These programs are uplifting not only students but communities as a whole.
Patrick, some of the Brighton Park Neighborhood Council's funding comes from Act Now. You all use that money to administer programming at Curie Metro High School on Chicago's Southwest Side. Talk about some of the programming that you all implement there.
It is an enormous amount of programming that we have at Curie. We have programming that happens during school and after school. It includes English language learning programming, tutoring programming, ACT prep programming, mentoring programming, where we hire former Curie students as college mentors to come back to the school and support at-risk students, all sorts of civic leadership programming. We also have a very robust parent, set of parent programs that include aerobics and fitness and English language learning program, ESL programming, GED programming. There's STEM programming for students. We have over 500 students at Curie that are enrolled in programming right now at Curie, and over 200 parents and community members. So this is a huge loss for the Southwest Side.
Susan, since the grant cuts were announced, Illinois schools have reported 277 staff layoffs, discontinuation of 708 student and family support programs. What has the fallout been like for the families in the schools that benefit from this funding?
It's been devastating. We got this news right before the holidays. Schools had no time to pivot to make alternative plans as to what they were going to do with their staff or what they were going to tell students. Some students left on winter break and they came back and their teachers or their clinicians were just gone without any explanation, no opportunity to say goodbye. Parents were scrambling on the first day back from break to figure out, what am I going to do with my child after school? I need to work. These were like very real impacts in the moment. Schools can't really maintain staff without a guarantee of long-term funding. So we are seeing services have been shut down, and it'll continue to get worse every single day till we get a long-term resolution.
Did you ever receive any reasoning or explanation from the Trump administration about why these grants had been cut?
We still don't have very definitive reasons as to what happened. The grants were terminated without any citing any specific activities we participated in or what we would have violated. And so we're still trying to ascertain that ourselves.
Patrick, Department of Education officials said diversity, equity, and inclusion policies are behind these cuts in funding, writing, quote, many of these programs use overt race preferences or perpetuate divisive concepts and stereotypes which no student should be exposed to. What is your response to that? Do you see this, Patrick, as, a move? Do you see this move as, further crackdown that the administration has done on DEI initiatives and programming?
I mean, it is so hard to respond to that claim. I know that we applied for this program with Curie High School, with Chicago Public Schools. The Department of Education approved the program plan that we put in place and all the partners throughout the state of Illinois. And we were in full compliance with everything that we set out to do. Curie is, it's a huge neighborhood school on the southwest side. It serves Latino students, it serves Black students, it serves Asian students, it serves white students. Every student at Curie is eligible for these programs. Obviously, we have some programs that are more, that are specifically tailored for students struggling academically or students that have, other social emotional issues or need some additional services. But every student's eligible for these programs. So we just don't understand, what the administration is saying when it makes its claim.
Now, each of you, you're a part of two separate lawsuits over this issue. Susan, tell us about the Act Now lawsuit and what you're all hoping to achieve.
Yes, so Act Now filed in federal court, and we asked for a temporary restraining order against the government's actions. That was unfortunately denied, but as it was, the department had stepped in and said they were willing to negotiate and re-examine the grant. We still don't have a resolution to that, and we're still considering what would further legal action look like, or, is there an opportunity to work with the department to figure this out? And so in our lawsuit, what we were trying to claim was that you need to cite to a grant activity or to some sort of deficiency in our performance in order to cancel a grant. And you can't just do that without a lack of clarity. So we're really focusing on the grants process and procedure.
Patrick, tell us a little bit about the Brighton Park Neighborhood Council. You all teamed up with the American Federation of Teachers in your own lawsuit. What are you all working towards?
A very similar goal. We are, essentially, Congress appropriated this funding and then reappropriated this funding. And, the fact that they are not complying with the grant as they were executed and appropriated, this is the issue. And so we believe that the cancellation or termination of the grant was done unlawfully, and so we're petitioning the court to reinstate this funding.
Patrick, what happens in the meantime? What if these funds don't materialize? Is there another way to fund this work?
Right now, we have been partnered with Curie for years in a variety of different ways. We are going to make sure to continue to partner. We're committed to Curie. We want to make sure that we're able to continue as many services and supports as we can. We're working with Chicago Public Schools to try to identify some additional funding if that's possible. But this is there are not a lot of resources right now, and we need to.
All right.
That's why these grants are so important.
All right, Patrick, thank you so much. That's where we'll have to leave it. Best of luck to each of you, Patrick Brosnan and Susan Stanton. Thank you.
Yeah.
Thank you.
And that is our show for this Wednesday night. You can stream Chicago Tonight on our WTTW YouTube channel every evening and catch up on any programs you may have missed. And you can join us tomorrow night at 5:30 and 10. The Trump administration freezes billions of dollars in funding for child care services in Democratic-led states, including Illinois. A look at the potential impact. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman. Thank you for watching. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm and sponsor of programming that offers continuing education to fellow legal practitioners in Illinois.